Hey friends, Cat Matlock here at FreeBody, and today we're talking about inner knee pain that's just below the knee on the inside. That's coming up. So if you have been told you have maybe pezanserine bursitis, or if you're having some maybe sharp inner knee pain, maybe some swelling, or just like an instability feeling in that inner knee, I'm going to talk to you about why this area is special, and then the simple practices you need to do. There's 3 muscles that you need to release to get rid of that pain and bring down that inflammation on the inner knee. So right here on this inner knee is a tendon that is a kind of wide tendon. It's an attachment site for 3 tendons that come off of it. And so it's called the pezanserine, which means duck's foot. So this is the duck-footed tendon here at the lower medial knee. So the 3 muscles that come off of this tendon, kind of like this, one of them flanks the quads and comes up and attaches actually up on the pelvis. That's called sartorius. Then there's one called gracilis that follows kind of the inseam of your pants and then attaches also up on the pelvis. That's our friend gracilis. And then another muscle that comes off is actually one of the hamstrings, and it's called semitendinosus. So we have semitendinosus hamstring, also attaches on the pelvis but on the sitting bone. Gracilis, which follows the inseam of the pants and comes up and attaches on the pelvis. And then sartorius, which comes up and attaches on that bony prominence in the front, called the ASIS. So sartorius, gracilis, and semitendinosus, one of the hamstrings. So think about that, like this muscle's pulling it this way, this muscle's pulling the knee in this way, and this muscle's pulling the knee into a bend. So you have this intersection of 3 different, in some ways opposing, right, movements pulling on the knee joint. When those muscles get out of whack, then this tendon can swell, or if those tendons get pulled taut, and this is really key, if those tendons get pulled taut because the muscles are kind of pulling on it all the time, that little bursa sac, that little cushion underneath this tendon will start to fill with fluid and swell because it's trying to relieve some of the pressure on that tendon. So bursitis is when a muscle is pulled really tight and it's pulling on that attachment, and so the bursa is trying to take some pressure out of that area. If you don't address these 3 muscles here, you may really struggle with getting rid of that inner knee pain or that bursitis. So there's a little bit of hip flexor, hip extensor kind of tug of war going on here. All these muscles bend the knee, and then all of them act differently in other ways on the knee. So it's a vulnerable area. Lots of folks come in and see me with inner knee pain. So I know you're ready. Let's get to work. You're going to need your soft ball, your firmer, larger ball, and a yoga block or the box that your tools came in. I also like to put a blanket down for my elbows to be up on. Makes it a little bit more comfortable. So let's get started. So I always like to start with the soft ball because I want to warm up the tissue, get my nervous system ready, and not start with a really hard, firm ball, especially in an area that's bothering me, right? The nice thing about the softball, one of the big gifts of this softball, is that you can actually roll right on bones with this softball. And that's important because doing a little bit of rolling on that softball around that tendon helps to hydrate the tendon. Remember, hydration is healing. Dry tissue cannot heal and cannot change. So rolling around, just circling that knee around on the soft ball really starts to get some hydration going around this area. When tendons are pulled taut, they get dry and they can't really change. So first step, nice rolling around right on that inner knee area. And then now we're going to go just above the knee and kind of sink in. And then move the leg up and down, kind of strumming across those tendons a little bit. And now next step is to get the ball halfway between the knee and the pelvis. Halfway between the knee and the pelvis, right on that inseam line. We're going to get real specific now, self-trigger point release right on gracilis. So you can lower yourself down, get the ball right in there, and then slide the knee up and down again. Ah, feels so good. And then you'll start to feel, oh yeah, as I get back here, yeah, I can feel there's a really tender spot. You might play with lifting the foot a little. Notice when I lift the foot, my thigh rolls inward. When I drop the foot, my thigh rolls outward. So in this way, you can really fine tune where your pressure is. Now this release is going to be great if you're also having groin pain. Gracilis can cause pain in the groin and the inner knee. So I got a good spot there. I'm going to keep my foot lifted a little bit. That's going to put the perfect pressure. You could even support that foot with a pillow or a block if it's feeling uncomfortable to hold it there. Take a couple of breaths. See how much you can relax your body and your muscles. So our first trigger point in gracilis, halfway between the knee and the pelvis. Now we're going to move that ball up a little further, a couple inches further, and we're going to want to get that ball up a little bit on that upper tendon. So that ball will need to be kind of forward because this muscle comes up to the pelvis. So check this out. We move the ball up a couple of inches. Now we really lift the foot. See how that shifts the angle? And I'm getting the ball kind of halfway between the middle thigh and the front of the thigh. And that's where I'm going to find, play with that angle. Lift the foot more, drop the foot a little bit. Play. When I get to about 45 degrees right there, I can feel a really tender spot. Now, if you have thicker tissue and you're not feeling it, you can, of course, switch to the firmer ball. I would say most folks would be fine with just this soft ball. You could play with bending and straightening the knee a little bit. That pin and movement often helps the trigger point to release. All right. Oh, so good. So that's our friend Sartorius. You could even go up a little higher. Lift that foot even more. Such a good spot right there. Lift that foot even more to rotate the thigh. I'm going to take 2 breaths here. All right. So now the last part, the last muscle of the 3, we addressed gracilis, we addressed sartorius. Now we need to get into that hamstring a little bit. So with the hamstring, we're going to get the ball a little bit above that inner knee and then turn the leg in a little bit. See how I drop that knee in a little bit so that I'm on that medial hamstring. Keeps the ball more focused there than, say, straight up and down. Now this one, I'm not feeling as much pressure, so I'm going to switch. Oh yeah, totally different. It's so good. I like to use the block because it allows me to shift the angle of my hip a little bit more. And then it's good to know that we're going through this more medial line, but on the back of the thigh now, closer to the middle than the outside of the leg, and sinking down into those lines of tendons, really ropes of muscle tissue. The hamstrings tend to hold their trigger points in this lower half, this lower section of the muscle. So good to, if you're in want the quick, really effective practice, stay low in that hamstring. And I'm going to turn to the side even a little bit. Let's show that a little bit more. So, so good. I keep that knee rotated in just a little bit. Sink on that ball. Now, if you want more pressure, you could sit up on that leg. Just depends on how flexible the rest of your body is. You could play with turning the block up a little bit. You could even, to get those hamstrings, come onto the floor and do a little bit more of a runner stretch. That's going to stretch the muscle out a little bit. For some of you, your hamstrings are just a little too tight, and that's not going to work. So this is really the easiest way. And then I'm going to find a spot in there. I'm going to sink into it. Great. Maybe do a little lift. Great. And then now I'm going to do a little bit of stretching of those muscles, right? They all bend the knee. So a straight leg is really beneficial for stretching, and a straight leg out a little wide to the side and bowing forward. You're going to lengthen, sit up really tall, and just bow forward a little bit. Feel the difference between the two sides. Now we've released along this right side. Feels good. Feels good. So now we're going to go and do the other side. So if you're having this on the left side, let's go through it for you folks with inner left knee pain. Starting with the ball, the soft ball, always the soft ball, right on that pes anserine area. You could play with some bend and straighten, rolling it around, just getting some hydration right on that tendon. If you have bursitis and it's too inflamed, just don't do it right on the tendon. That's okay, right? So just working around that inner knee. Then we're going to get right above the knee. Just let the ball sink in. Do a little sliding of the knee up and down. And what that's doing is just kind of gently separating, like prying those tendons apart from being all stuck together. And then we're going to move up now into that halfway between the inner knee and the pelvis. So look at your thigh. Halfway up between the inner knee and the pelvis. Get the ball right in that halfway mark. And you should feel, as soon as you drop on, you'll go, oh yeah, there's a tender spot right there. So maybe sliding, circling, playing with the angle, lift the foot, drop the foot. Notice how that angle shifts your experience. Sink down into it. Couple breaths. All right. We're going to go up further. Now we're toward the top of the thigh. That sartorius travels up to the front of the pelvis. So to get into sartorius, we have to start to lift the foot. That shifts our angle. Now I can really feel there's a really tender spot in there. Couple breaths always. Relaxing the rest of your body as much as possible. We're going to see if there's another spot a little higher up. So as it goes higher up, it goes further out. So lift that foot even more. If you need more pressure, you can turn your body. Oh, that really got it. My sensitivity is more on my right side, so I had to work a little harder to find something here that's normal. One side often feels different than the other side. Okay. Now we're going to get up and do that hamstring release. You can start with that soft ball, go side to side, warming up those tendons. We're going to have to turn that leg a little bit, and we're going to have to get up a little higher. I'm going to use a firmer ball. That's it. See how my knee drops in a little bit there? I'm just a couple inches above the knee joint. And just a reminder, it can feel a little sensitive and not be like the craziest feeling you've had all day, the worst pain you've had all day, right? If that's true, you want to go back to a softer ball. Semitendinosus, hamstring. You can sink in, you can bow forward a little bit. All right. Do a little bend and straighten, move that ball and block out of the way. Widen the legs a little, bow forward. Great. And that's it for releasing the pezanserine, that pull on the pezanserine that can cause inner knee pain. Once again, those three muscles are sartorius that come up to the pelvis. It's also a hip flexor, also a hip rotator. Gracilis running right up the inseam of the pants also draws the legs towards each other as well as bends the knee. And then that medial hamstring semitendinosus that comes forward and attaches also into that pezanserine. So you can see with these three pulls in different lines of direction, that inner knee is kind of under a lot of pressure all the time. And this is the practice that you want to do to alleviate that pressure. And hey, wait, before you go, I want to talk to you a little bit about the conditions that can create this problem in the first place. Because one thing I understand after working with folks for 30 years in their bodies is that we could keep going to what's happening. We can keep trying to fix the pain, but if we're actually not addressing the conditions that cause the pain, then ultimately that pain just keeps coming back, right? You've probably had that experience. So I want to talk to you about one really key, what I think is the key to this situation getting set up in your body in the first place. And that is having a leg length inequality, having one hip that sits higher than the other. Because as I said earlier in this video, all three of these muscles attach into the pelvis, the hamstring onto the sitting bone, the gracilis onto like right near the pubic bone, and then the sartorius attaching up high on that ASIS. They're all pulling also on the pelvis, and the pelvis is pulling on them. So if this hip goes high, and that's going to pull all of those muscles kind of out of whack. So if you're doing this release, sartorius, gracilis, that hamstring semitendinosus, if you're doing that release over and over again, and it's not really, it might feel better, but it's not totally changing, you might want to also look at, well, do I have one hip that sits higher than the other? Or have I been told that by my chiropractor or my PT? And you'll want to see what you see in the mirror. So we're going to link this video right up here. That's the one that you want to watch to see if you indeed have one hip that sits higher than the other. And there's a simple practice in there to help write it. We're, again, working on a whole playlist for addressing this issue because I see that it's a root cause of a lot of problems in the body. And this medial or inner knee pain is one of a host of things that you can experience as pain or discomfort because one hip sits high. So remember, this happens, this inner knee pain or pezanserine bursitis almost always happens on the high hip side. So watch that video, check it out. Thanks for watching. Best wishes.